Hello, Kristalina.
Hello. Who is that? Is that Tedros?
Hello, Ngozi.
Hi, David. Hi, Kristalina.
Hey, Ngozi. Hey, David.
Hi.
I don't see anybody. I just hear voices. So my apologies.
Why not? Why can't you see us?
I don't know why I don't see anybody. I see the sign for WHO, and that's it.
Oh.
And here you are. Now I see you.
We're already live, actually, colleagues. So please just bear with us before we start. Thank you so much.
Oh, we're already live? Oh.
Just to clarify, we're already live on the Zoom. We have journalists already on the line. We're not streaming yet.
Why don't I have the IMF behind me?
We have a bug in the corner. It's laid over top. So we have the IMF in the upper right corner.
Okay.
Feeding into there.
Okay. Yeah, I see it. Yeah.
Hello and good day to
Mesdames et messieurs, bonjour ou bonsoir. Nous sommes mardi 1er juin 2021. Mon nom est Christiane Lindmeier et je vous souhaite la bienvenue à cette conférence de presse sur les dernières nouvelles relatives à la Covid-19 avec un nouvel appel conjoint à accélérer l'accès équitable aux vaccins contre la Covid par les responsables du Fonds monétaire international, de la Banque mondiale, de l'Organisation internationale mondiale de la santé et de l'Organisation mondiale du commerce. Nos invités aujourd'hui, Madame Kristalina Georgieva, directrice du Fonds monétaire international, Monsieur David Malpass, président de la Banque mondiale, Dr Ngozi Okonjo-Iweala, directrice générale de l'Organisation mondiale du commerce, et le Dr Tedros, directeur général de l'OMS. L'interprétation est disponible dans les 6 langues onusiennes officielles, arabe, chinois, français, anglais, espagnol et russe, mais aussi le portugais et l'hindi.
the other participants we will have in the room here
Nous avons d'autres
are, apart from
participants
Dr.
dans la
Tedros,
salle, à part le Dr.
Dr.
Tedros,
Mike Ryan, who will join us shortly, the Executive Director of the Health Emergencies Program, Dr. Maria van Kerkhove, the Technical Lead for COVID-19, Dr. Soumya Swaminathan, Chief Scientist, Dr. Bruce Aylward, Senior Advisor to the Director General, Dr. Kate O'Brien, Director for Immunization, Vaccines and Biologicals, and Dr. Rogerio Gaspar, Director for Regulation and Pre-Qualification. With this, let me hand over to Dr. Tedros for the opening remarks. The floor is yours.
Vous avez la parole, Dr. Tedros. Merci, Christian. Mesdames et messieurs, bonjour ou bonsoir. Hier, l'Assemblée mondiale de la santé a terminé une semaine fructueuse de discussions. Une assemblée qui s'est tenue entièrement de façon virtuelle. J'ai hâte de rencontrer mes collègues en personne, mais j'ai néanmoins été réconfortée par le fait d'avoir adopté plus de 30 résolutions et décisions sur une large gamme de défis sanitaires. Il y a un consensus clair selon lequel le monde a besoin d'une OMS plus forte, et ceci encore plus forte que jamais. Et les 3 derniers examens de la riposte internationale à la pandémie ont reflété la nécessité d'un changement de paradigme, aussi bien dans la quantité que dans la qualité du financement de l'OMS. Les États membres ont convenu de tenir cette session extraordinaire de l'OMS, de l'AMS, en novembre pour envisager de développer un traité, une convention sur la préparation et la riposte à la pandémie. Cela consistera en une occasion très importante d'un nouveau concept représentatif pour faire en sorte que nos systèmes de santé, nos sociétés et nos économies soient plus sûrs. Mais nous ne devons pas oublier qu'il y a encore du pain sur la planche pour en terminer avec cette pandémie. Nous sommes néanmoins encouragés de voir qu'il y a des cas et des décès qui continuent de décliner de façon mondiale, mais il n'est pas le temps de nous reposer sur nos lauriers. L'usage systématique de mesures de santé publique combinées à un accès équitable aux fournitures médicales, à l'oxygène, aux tests, aux traitements, aux vaccins reste crucial. Demain, le COVAX, dirigé par Gavi, la CEPI et l'OMS, avec un partenaire de mise en œuvre, l'UNICEF, va essayer de lever des nouveaux fonds cruciaux pour acheter des vaccins pour les pays à revenus faibles et intermédiaires. Ceci est déterminant pour mettre fin à la pandémie qui est de plus en plus sur 2 pistes. Et aujourd'hui, je suis ravie d'annoncer que le vaccin Sinovac-Coronavac a reçu la notation sur la liste d'usage d'urgence car il a été considéré comme sûr et efficace après les 2 injections du vaccin inactivé. Ces exigences en matière de stockage facile le rendent disponible pour des environnements à faibles ressources. Et c'est le 7e vaccin à recevoir cette désignation. Pendant la nuit, j'ai rejoint les dirigeants du FMI, de l'OMC, de la Banque mondiale. Et nous avons publié dans de nombreux journaux dans le monde un engagement pour 50 milliards de dollars pour financer la distribution.
And other crucial health tools. We particularly welcome that in the proposal, the majority of the new funding would be made available quickly through grants, including to fill the Act Accelerates funding gap. This would help us dramatically scale up the production of diagnostics, treatments, oxygen, medical equipment, and vaccines for equitable distribution. Furthermore, this new roadmap reflects the need to enhance countries' readiness and capacity systems to utilize these tools rapidly, safely, and effectively. It should be a real game changer, and as G7 finance leaders meet in the UK this week, followed by a heads of state summit next week, there are multiple opportunities for leaders to step up. As well as securing funds to roll out health tools equitably, now is the moment for leaders to share vaccine doses with COVAX, ensure health workers and other at-risk people are protected, and extinguish variants. Last week, I called for all countries, companies, and partners to work together to vaccinate at least 10% of the population of every country by September and at least 30% by the end of the year. But as we said in our joint op-ed, along with other agreements and surge investment, it's possible that we could reach 40% by the end of the year. Through public health measures and vaccines, we have the means to end this pandemic quickly and save countless lives and livelihoods. But we need the will to make it happen. They say, where there is a will, there is a way. We know the way. The question is, do we have the will? To say more about how this can be achieved, I'm glad today to be joined by Kristalina Georgieva, the Managing Director of the International Monetary Fund. Kristalina, thank you so much for joining us today, and you have the floor.
Thank you very much, Dr. Tedros, for hosting this press conference, and also to you, the staff of WHO, and all the health workers for your selfless service to humanity. Very pleased to join you, as well as David and Ngozi, to discuss a matter of great urgency, the need to step up multifaceted and coordinated action to fight the pandemic in the parts of the world falling behind, mostly because of uneven distribution of vaccines between richer and poorer countries. You may ask, why is the IMF concerned with vaccinations? We are deeply concerned because an increasingly two-track pandemic is causing a two-track economic recovery with negative consequences for all countries. And our data shows that in the near term, vaccinating the world is the most effective way to boost global output. In other words, vaccine policy is economic policy. Building on the work of WHO, WTO, the World Bank, and many others, our staff has put forward a proposal, a $50 billion plan to end the pandemic. It has three broad elements, and as you suggested, I would walk everybody on this call through those. First, vaccinating at least 40% of the population in all countries by end 2021, and at least 60% by the first half of 2022. This requires additional upfront grants to COVAX, donating surplus doses, and free cross-border flows of raw materials and finished vaccines. Second, ensuring against downside risks such as new variants. This means investing in additional vaccine production capacity by 1 billion doses, diversifying production, and scaling up surveillance and contingency plans to handle virus mutations or supply shocks. Third, managing the interim period where vaccine supply is limited with widespread testing and tracing, therapeutics, and public health measures. In other words, the things we learn work. And at the same time, ramping up preparations for vaccine deployment in the countries falling behind. Of the $50 billion, we envisage grant financing of at least $35 billion. G20 governments have recognized the importance of providing about $22 billion in additional funding for 2021 to the ACT Accelerator, so we need an additional $13 billion in grants. The remainder of the financing plan, around $15 billion, could come from national governments, supported by concessional financing from multilateral development banks, such as the World Bank on the call today. The $50 billion price tag is dwarfed by the estimated $9 trillion to be gained by the increase in economic activity by 2025, making it the best public investment ever. Success depends on speed, upfront financing, upfront vaccine donation, upfront at-risk precautionary investments, and coordination, all parties working in tandem, public, private, international financial institutions, foundations. And our 4 institutions fully subscribed to it. We at the IMF will not shy away from our own responsibility. We will continue to work with the international community towards faster vaccination and faster recovery, so we can ensure maximum efficiency and maximum impact from our collective efforts. We are considering how to complement grants and highly concessional financing from others for COVID vaccinations where this is needed. And we are preparing a new special drawing rights allocation, unprecedented in its size, to boost reserves and liquidity of all our member countries. Bottom line, ending the pandemic is a solvable problem, but it requires coordinated global action now. Thank you, Tedros.
Thank you, Kristalina. I couldn't agree more that this new injection of funds is critical to increasing the supply of life-saving medical tools and end the pandemic. Next, it gives me great pleasure to welcome Dr. Ngozi Okonjo-Iweala, the Director General of the World Trade Organization. Ngozi, you have the floor.
Well, thank you, Dr. Tedros, very much for having us today. And I just want to make a point. I want to also thank Kristalina and the IMF staff for their paper. But I want to say that we often talk of collaboration of international institutions and coherence. The very fact that the 4 of us are here today and our institutions represented is very important, because we know it's about saving lives. And this is the time we have to work together. And we are talking about saving lives of people in developing countries, saying that they'll never lag behind. That is why we've come together, and thank you all. I want to thank my colleagues and their staff for bringing us here. Now, there's a joke about 2 economists out for a walk. One sees a $100 bill on the ground and exclaims, "Look, there's a $100 bill on the sidewalk." The second economist doesn't even look down. She says, "It can't be a $100 bill. If it was, someone would have picked it up by now." In the IMF staff paper, as that Kristalina talked about, we've been shown that there are trillion-dollar bills on the sidewalk. To pick them up, we just need to invest $50 billion up front. And we need more cooperation on trade as well. After some initial disruptions, I just want to tell you the role that trade has played. Many people are not aware about that after the initial disruptions in supply chains, trade played a critical role in moving medical supplies and goods around. For instance, in 2020, total global merchandise trade shrank by 7% in value terms, but the value of trade in medical supplies rose by 16%. Trade in COVID-relevant products such as masks, ventilators, sterilizer, and ultrasonic scanners increased by 31%. Trade in test kits and diagnostic reagents grew by over 40%. For personal protective equipment, PPEs, trade grew by 50%. Even with agriculture, global agricultural trade remained stable throughout 2020, bolstering food security, which was another area of concern for leaders. And of course, COVID-19 vaccines manufactured in multi-country value chains. We know that these value chains are very sophisticated and complex. We've all heard of the example of the Pfizer-BioNTech vaccine using 280 components from 86 sites in 19 countries. But it was trade that helped to move these supplies around. But we've also had constraints on trade. Export restrictions are a challenge that we continue to face and monitor. While it is positive that the number of measures of export restrictions has come down from 109 at the start of the pandemic to 51, there are signs that trade restrictions are still gumming up COVID-19 vaccine supply chains and weighing on production. Trade policy can help with vaccine scale-up in 3 areas. First, by freeing up supply chains for raw materials and finished vaccines. Second, by working with manufacturers to make the most of existing production facilities and building new manufacturing capacity, especially in regions that lack it. Working with manufacturers to keep supply chains open is essential for us to get more vaccines. Third, we know that there's a TRIPS waiver debate going on at the WTO, and while I cannot take sides, we need to get to a conclusion on this debate. We need to promote also the transfer of technology and know-how to get lasting increases in production capacity. WTO members can and should deliver on all 3 fronts this year. And to echo Kristalina, we increasingly see a world divided by access to vaccines and by economic prospects. The 2 are, of course, related. That's why she said vaccine policy is economic policy. The divergence is visible in the trade data, too. In Europe and North America, import volumes are set to surpass pre-pandemic levels this year. By 2022, European imports are said to be almost 4% higher, and exports 3.5% higher than in 2019. Over the same 3-year period, North American imports are set to rise by 9.7% and exports by almost 4%. Asian imports will grow by a large 9% and exports by an even larger 12.5%. But in contrast, Latin American imports will increase by a modest 1.7% and exports by 1.2%. And in Africa, imports are only on track to reach pre-pandemic levels by 2022. Exports are projected to have risen 2.3% by then. So I say also that vaccine policy is trade policy and vice versa. We won't get the vaccine production increase we need without action on trade. And without ending vaccine scarcity, we cannot get the lasting trade and economic recovery we need. We want global cooperation to save lives and pick up those trillion-dollar bills. Thank you.
Thank you. Thank you so much, Ngozi, in fighting this pandemic since the beginning in a variety of roles. And I appreciate your point that as well as financing, the WTO is doing all it can to ensure the smooth flow of vaccines and raw materials across borders to increase access, while also accelerating negotiations around intellectual property. Finally, we're joined by David Malpass, President of the World Bank Group. David, thank you so much for joining, and the floor is yours.
Thank you very, very much. I join my colleagues in expressing the urgency to quickly make approved vaccines available to everyone. Each of us has an important role in this global vaccination effort. My immediate priority is for countries that have sufficient supply to quickly release doses to countries that have vaccination deployment programs. The World Bank has $12 billion in vaccine financing available now and more if needed to help countries buy and distribute COVID-19 vaccines and to encourage vaccinations. By the end of June, we will have approved vaccination operations in over 50 countries. These countries can immediately use vaccines from COVAX, from manufacturers, and from donor countries themselves as soon as they are made available. It's vital that we speed up the supply chain. We need to shorten the time from the manufacturing of the vaccine to shots in arms. At present, too many doses are waiting to be allocated. They may be stuck in paperwork, sitting in inventory somewhere, or aren't the type of vaccine the country is able to use. In order to maximize the number of vaccinations, doses need to be matched to country programs as soon as they are manufactured. It's important to share information about the allocations so countries can plan ahead. The World Bank is providing transparent access to very detailed information about our projects through an online portal available at worldbank.org/vaccines. We urge other development partners to publish detailed information about their vaccine financing and deployment programs and their delivery schedules. Our website also links to the 140 vaccine readiness assessments referred to in our op-ed today. These will help us fill capacity gaps and rapidly add more financing operations. The financing can be available to countries immediately. For the poorest countries, it is on grant or highly concessional terms. We're also working to expand supply, and we'll be making announcements of investments by IFC, the World Bank Group's private sector development arm. Each day counts in providing vaccine supplies to developing countries with deployment programs in place. I look forward to working closely with my colleagues on these vital tasks. And with that, thank you very much.
Laid out a comprehensive new health, trade, and economic roadmap to increase health equity and speed up a truly global and quick recovery. I thank you again, and Christian, back to you.
Thank you very much, all. Thank you, Dr. Tedros. With this, we open the round for questions and answers from the media. We have a long list already, but if you still intend to get into the line, please raise your hand with the raise your hand icon and unmute yourself when it's your turn. First question on my list goes to Maoling Zhang from Xinhua. Maoling, please unmute yourself.
Hi, can you hear me?
Very well, go ahead.
Okay, thank you. I'm Maoling Zhang with China Xinhua News Agency. Thank you so much for this opportunity. I have two questions. Firstly, I would like to ask Madam Georgieva. The IMF has been arguing repeatedly that vaccine policy is economic policy. Do you think all major countries now understand this? And the second question is for all panelists, if possible. You've all mentioned limited vaccine supply. So I was wondering, what are the main bottlenecks for expanding vaccine production and supply globally? Thank you very much.
Thank you very much. And let me hand over to Kristalina Georgieva, the Managing Director of the IMF.
Thank you very much for this question. It is now increasingly clear to leaders everywhere and to ordinary people that we are not going to succeed in overcoming the economic crisis this pandemic triggered unless we bring the pandemic to a durable end. In our engagement with ministers of finance around the world, G7, G20, in our own configuration representing 190 countries, there is now very clear understanding that we face two problems. One, the problem of divergence. Countries with more fiscal space and rapid vaccinations are coming out of the crisis fast, they're growing, but those, especially with low vaccination rates, are falling further behind. And that is dangerous for everyone because it would hold the global recovery back. And second, that we are creating a breeding ground for mutations unless we act decisively to accelerate the ending of the pandemic everywhere around the world. At the IMF, we are committed to continue to provide credible and up-to-date assessment of how vaccinations are linked to the economic recovery. We came up with a huge benefit, a huge number, $9 trillion between now and 2025, should we move with vaccinations much faster everywhere. And it is important to recognize that 60% of the benefits of this 60% of this 9 trillion would go to emerging markets and developing countries, but 40% would go to advanced economies. They will generate $1 trillion of fiscal revenues as a result of global action. And we will continue to stay on that message so we mobilize everybody to step forward for the benefit of all.
Thank you very much. Maybe the second part of the question we could ask Dr. Ngozi from the World Trade Organization.
Well, thank you very much. I mean, that's a very important question on limited vaccine supply and the main bottlenecks. Let me just name 2 or 3 that manufacturers themselves, pharmaceutical companies, talk about. First and foremost, I think we have a constraint on manufacturing capacity. The world normally has capacity to manufacture about 5 billion doses of vaccines. But now we need 10 to 15 billion doses, depending on whether we need boosters. So this is 2 to 3 times the capacity. So we just didn't invest enough in manufacturing capacity. And that's why we've been working with manufacturers, along with Dr. Tedros, the WHO, CEPI, Gavi, a vaccine task force, to work with the industry to try to rectify this. This goes along with issues of transfer of technology and know-how for manufacturing, of course, including considerations of how to come to a good agreement on IP issues, waiver of the IP. I think the second factor is raw material supplies that many manufacturers mention. They are competing with other types of vaccines, with cancer drugs for these raw materials and supplies. So there's a scarcity. I think the third part is skills. To make vaccines, you really need specialized skills because of how quality is so important in the area of vaccines. And these are not always in much supply. And then fourth, I talked before about export restrictions and prohibitions. Some countries still have restrictions on raw material supplies moving into supply chains, and bureaucracy also in some countries are hindering the movement. You heard David Malpass refer to, removing bureaucracy, facilitating things to move faster. So those are 4 factors that I think we need to work with in order to also boost supplies.
Thank you. Let me go with the next question in line, and that's Corinne Gretler from Bloomberg. But at the same time, let me please remind everyone looking at the long list of journalists interested in asking questions, so please only ask one question at a time. Thank you very much. Corinne, go ahead.
Hi, thanks for taking my question. It's one for the WHO officials. I wanted to ask about the variant first detected in Vietnam, which the country's health ministry has said is like a hybrid of the Alpha and Delta strains. So I just wanted to see, is the WHO paying special attention to it? What do you know about it so far? Might it be a candidate for a variant to be a variant of interest? Just kind of your update on it.
Thank you very much. And Dr. Maria van Kerkhove, please.
Thank you for the question, and I particularly appreciate you using the new WHO labels that we announced yesterday, so thank you very much for that. So yes, as you know, there are variants that are being detected around the world, and this is happening because there's good surveillance for the SARS-CoV-2 virus, and there's good genomic sequencing that is happening around the world, and that, in fact, has been increasing since the pandemic began. This virus variant that has been detected in Vietnam and reported by the Ministry of Health in Vietnam is the B.1.617.2, the Delta variant that we recently provided a label for to remove some of the stigma associated with the countries that have reported these variants. What we understand is that it is this B.1.617.2 variant with one additional deletion in the location in the spike protein. We know that the B.1.617.2, the Delta variant, does have increased transmissibility, which means it can spread easier between people. It has to do with the mutations that are identified and allowing the virus to adhere to the cell and infect the cell more easily. What I think it's important to remember is that all of these variants are combinations of mutations. So this has been reported as a hybrid, but in fact what it is it's this one mutation, the Delta variant, with an additional deletion. And so what we are really seeing is this convergence of evolution and the changes in these mutations, the changes in the virus, which is to be expected because with more than 170 million cases reported to date, which is truly an underestimate of the true number of infections worldwide, this virus will continue to change. We're grateful for surveillance to be conducted. We are grateful for these variants to be reported. We want to encourage this to continue to happen. There are studies that are underway to look more carefully at the Delta variant and looking at these specific mutations. The more we learn about this, the more we will report. But we do know with increased transmissibility, this means that public health and social measures do work, but they do need to be enforced and used. And so with the 4 variants of concern that WHO is tracking worldwide, our public health and social measures continue to work. The diagnostics, the therapeutics, and vaccines are still effective against the variants of concern, and so we really need to do what we can to drive down transmission. And I will just emphasize that in Vietnam, they have a lot of experience with infectious diseases and working towards controlling the spread of SARS-CoV-2 and other infectious pathogens. So we continue to advise good surveillance to happen worldwide and reporting of this information through these existing systems.
Thank you very much, Dr. van Kerkhove. We go to Margarida Serra from TSF Radio Portugal, and I understand we do not have Portuguese translation, so please use another language. Thank you. Margarita, can you try to unmute yourself, please? Okay, we don't seem to get to her. The next in line is Nina Larsen from the AFP. Nina, please unmute yourself.
Yes, hello. Thank you for taking my question. I wanted to go back to the issue of lacking vaccines. You're calling today for an investment of $50 billion for more equitable distribution of the vaccines, but even with all that money, COVAX is still facing a huge supply gap, which is largely due right now to the situation in India, which has cut off the supply of AstraZeneca vaccines from the Serum Institute. What chances do you see of catching up with where you wanted to be with the deliveries without the Serum Institute participation? And are you expecting the Chinese vaccines that have now received emergency use approval to go into COVAX fill the gap. Thank you very much.
Thank you very much, Nina. And Dr. Bruce Aylward, I guess. Thank you.
Thank you very much, Christian, and thank you, Inga. I think one of the key findings from the analytics that the IMF did is that there are enough vaccines in the world to get to the levels of coverage that are being, let's say, aspired to in the paper. Now, to get there, we have the COVAX supplies that get us part of the way there. We have additional products coming on in this quarter. We are looking, as we announced a couple of weeks ago, the J&J vaccine. There's additional Pfizer product. There's additional AZ product also coming through there. But in addition to that, as the IMF highlights, we need the countries that have contracted large volumes to be able to donate those doses. And at the Global Health Summit, we had some great announcements of a commitment from Team Europe to get to over 100 million doses this year. We've seen from the United States a commitment to donate in excess of 80 million doses. And these are great. The challenge now is going to be to bring the timing forward, because the crucial period, like you say, Inga, is in the coming weeks and months. If we get behind the 8 ball now, it's going to be very difficult to catch up and realize the kind of benefits that Dr. Georgieva laid out in her comments. So the big call is to bring forward those donations as early as possible, to fully finance COVAX and the ACT Accelerator so we can further diversify the portfolio. Like you said, there are new products now that have WHO EUL and could potentially be used. And of course, we're calling, as Dr. Ngozi had mentioned, to look at other opportunities to increase the speed with which we can fill finished products and get them used. So the bottom line is the vaccines are there in the world to get there. The issue is the distribution of those, the scaling of those as rapidly as possible, and crucially, the sharing of those. And that's what the call is for, to bring all of that forward, front load that, so we can realize the promise of the plan, this bold plan that's been laid out.
Thank you very much, Dr. Aylward. And I understand we will see if Geeta Gopinath, the IMF Economic Council and Research Department Director, would add something.
I just completely endorse what Bruce just said, which is, if you look at the problem, the reason that everybody here, including the managing director, Georgieva, said that this is a solvable problem is because even under very conservative assumptions, you do have a significant amount of vaccines coming through in the pipeline to achieve that 40% target. The problem is in terms of who has access to those vaccines. This is why we need upfront vaccine donations, also to prevent spoilage so that we're not wasting doses that are sitting in some refrigerator. Those donations have to be made now. We need, as Dr. Ngozi said, to remove restrictions on exports of raw materials and of finished vaccines. These are very small steps actually that are needed. This is a solvable problem, and we can get to these targets as long as we work in a coordinated fashion.
Thank you very much. And just to give you all the name again, that was Dr. Geeta Gopinath, the IMF Economic Counselor and Research Department Lead. Next question line goes to Claudia Torrens from the AP. Claudia, please unmute yourself.
Hello, can you hear me?
Very well, go ahead.
Great, thank you so much for taking my question. Maybe this is for the International Monetary Fund. Latin America has been very hard hit by the pandemic. Could you maybe be a bit more specific and tell us how of a priority Latin America is, and how exactly will all these millions help the region?
Thank you very much. And yes, Ms. Georgieva, please, and I guess we will ask Mr. Malpass afterwards.
Yeah. Yes. So the proposal talks about moving vaccines as quickly as possible where they would make biggest impact. And one of the observations we make is that while it is important that there is distribution based on population, we also have to think about where the urgency to act is most significant. And unfortunately for Latin America, quite a number of countries are hit with a brutal force of COVID-19. And therefore, what we would argue is to make sure that we have the ability to supply vaccines where we would save most lives. COVAX does have a clause that allows for it, and our paper recommends that we are thoughtful and reflectful on that clause. I am in constant contact with many of the leaders of Latin America, and one of the issues each one of them would put on top of list is where are the vaccines? Even countries that have the money to purchase cannot access them. And therefore, this mobilization that Gita and Bruce talked about, actions from all perspectives, which is produce more, distribute fast to where it is most needed, including vaccines that are likely to be in excess in the countries that book them. Do that upfront. And since I have the floor, I want to recognize that we have Gita Gobinar, who led the work on the call. We also have Ruchir Agarwal, the other author of the plan. I cannot tell you how important it is to act comprehensively and not zero in on one only piece. And that for Latin America is even more important than it is for the rest of the world. I want to ask Gita, do you want to add anything, or we should move to David?
I think we should move to David. Thank you.
David.
Thank you. So it's critical to match the supply with the countries that have programs. In Latin America, we have programs in Ecuador, El Salvador, and Honduras. They're seeking 220 million doses. So you might say, how can that even be possible? Well, that's necessary for the population and for the double doses when you work it out. So we have financing available, and the critical thing then is countries that have excess supply or sufficient supply to free those up. And Kristalina made this point, and these are critical points that as we look at the U.S., the vaccination effort is going to a very young age. And so one of the things that needs to be done in a fairness and in a safety for the whole world, we need to be vaccinating vulnerable people around the world right now. And that means freeing up the doses to programs that are in place. So that's what I'm urging, and we're ready to work on new programs. We can push new programs through the board very quickly with a fast-track approach, and there's a receptivity to doing that, and we need countries to have more confidence. Kristalina makes this point well frequently, that one of the key things we're trying to do is build confidence in countries so that they can get their economies going back, getting back in order. So we look forward to that, but the critical thing here is to free up excess supplies from those countries that are in excess. And that, one positive thing I want to say, my impression from the vaccine manufacturers is that their supply is ramping up very rapidly. They're talking about production levels that will reach billions of doses in late this year or into 2022. And so this is critical. These next few weeks are vital that, in particular, the U.S. frees up excess to go to programs that exist. We're ready to take them tomorrow in the 3 countries I mentioned, and by 2 weeks from now in more countries within Latin America. Thanks.
Thank you very much, both. Next question goes to Valeria Roman from Infomae. Valeria, please unmute yourself. Do you hear us?
Hello, can you hear me?
Valeria?
Hello, can you hear me?
Yes, hear you well.
I would like to know how this proposal by different international organizations can help Argentina and other Latin American countries with the access to the vaccine exactly.
Thank you very much, Valeria. Let me look around. Maybe Dr. Aylward.
Sure. Thank you very much, Christian. I didn't capture the whole question, but if I understood it was specifically how the plan and the actions could actually help countries such as Argentina in terms of accessing more vaccines. And if that's correct, the intent of the plan is to ensure that all countries can access more vaccine more rapidly, especially those who are currently, let's say, lagging behind the goals that we've set to be at least 10% by the end of September in terms of coverage globally, and then to 40% by the end of this year. Now, as Dr. Georgieva just laid out in her comments, this means there have to be multiple solutions. So that means vaccine donations from countries that have contracted lots of doses. It means increased production. It means freeing up the movement of vaccines as well as the raw materials necessary to do them. So the key here is really moving across all of those dimensions to move increased volumes globally as rapidly as possible and to try and address gaps in the distribution that we face today. So really it's a holistic approach that should benefit all countries, certainly economically, and all countries in terms of vaccines, and then obviously countries in terms of reduced disease, ideally, and especially mortality and morbidity in the near term.
Thank you very much. And Dr. Mike Ryan, please.
Sorry, and just maybe in relation to both of those questions, not specifically on vaccines, but just to reflect on the fact that the situation in South America right now remains of very high concern for WHO and for our colleagues in the Pan American Health Organization or American Regional Office in Washington. 8 out of the top 10 countries reporting the highest mortality rates per population in the last week have been from the region of the Americas, and particularly from South America. South American countries represent 4 of the top 10 countries globally, just in case incidents over the last week. And those countries include Paraguay, Uruguay, Argentina, Colombia, Brazil, followed by Bolivia, Peru, and Chile. So there are real challenges in South America still, and mortality, has increased in some countries, particularly in Paraguay and Bolivia, by over 20% in the last week. And when you look at case fatality rates in South America in general, they are higher than in many parts of the rest of the world, ranging from 3 to 5%. And again, that may reflect severity of disease, but it also reflects access to adequate health care and the pressure that the system has been under in many South American countries for a very long time, despite the wonderful efforts of healthcare workers and healthcare systems to do that. So test positivity remains remarkably high in some countries. In Paraguay, it's nearly 37%, in Argentina 33%, in Colombia 30%, in Ecuador 29%. And very few countries actually in South America have rates below 10%. So again, the disease transmission is intense, community transmission is widespread, the healthcare system remains under pressure, and that's been reflected in mortality rates. So I think it is very, very important, and the question was asked, the impact, the point of impact of this pandemic shifts. And we're moving from looking at the tragedy of India and Nepal, and that point of impact shifts. And it's really been driven by the underlying incidence and the basic capacity of the health system to cope. And in the absence of high levels of vaccination, they're the two factors that are going to drive the impact of this disease in the coming months. How intense is transmission? How well is your system able to cope with that transmission? Vaccine can break that cycle, because right now, intense transmission in every country in the world has led to intense pressure on the health system and increasing case fatality rates. Vaccination can break that cycle. Continuing to implement public health and social measures can break that cycle. But that cycle will continue, and we will, unfortunately at the moment, I think, if any of you have children, you watch your kids playing football, and they all chase around the field after a football because we all chase the thing that's moving. And the moving target right now is the point of impact of this pandemic. And we have to take a step back and realise we have to break that cycle. We simply have to break that cycle. And vaccination and increased vaccination rollout, a continued support to public health and social measures. You see in countries like Malaysia today have had to implement very strict public health and social measures again because they simply do not have the vaccine to make the difference right now. So countries who've done well up to now, countries who've sustained their effort over many months, kept mortality and incidence rates low, are struggling to do that a year and a half into the pandemic, struggling to ask their populations to even go further. Very, very hard, while they watch other countries being vaccinated left, right and centre. So there are many issues to consider here, but I think it is important that we do look. South America was really in a difficult situation only a couple of months ago, and that situation again is starting to turn in the wrong direction, and we need to take account of that. Thank you.
Dr. Aylward, please.
Just to come in briefly on the point that Mike was making, one of the things that gets lost sometimes in looking at the IMF proposal, and Dr. Georgieva, you may wish to speak to this, Kristalina. If you look at the proposal, we talk about the vaccine piece of it, but if you look at the third element of this proposal that Kristalina emphasized, it was ensuring that as we are rolling out the vaccines, we scale up the tests, the oxygen, the dexamethasone, get the PPE out there. And in fact, if you look at that $50 billion investment, the majority of it is to try and get those public health measures out there and scaled rapidly to save lives and ensure that we are reducing transmission through those measures, as Mike emphasized. So it's not one thing or another. It's the whole package, faster with the upfront financing needed and the collaboration internationally to be able to put it all in place.
Thank you very much, Dr. Aylward. And since we're running out of time, we'll go now to a last round of comments from our special guests. And I'm checking who needs to go first, because we have somebody who needs to leave very soon. I think that's Ms. Georgieva.
I thought it was Dr. Ngozi that had a pressing appointment, so I would let her go first.
Thank you very much for this, and then Dr. Ngozi, please.
Well, thank you. All I want to say is that we should just keep in mind that we are talking about saving lives, and we have the tools with which to do it. We have the finances in the world with which to do it. We have the policy mix with which to do it. That's why we've made sure that this op-ed we did went to all the G7 countries before they have their summit, so that they'll pay heed. A world in which people have to queue in line to get life-saving vaccines when we have the technology is one that does not work, neither for those countries nor for the rich countries. I think you've had all the numbers and all the reasons why it doesn't work. So I just want to say to the media, please help us spread this message. It will save lives. Thank you.
Thank you very much, Dr. Ngozi. Then now I look at David Malpass, President of the World Bank Group, please.
Thank you very much. It's good to be here today. The world is facing these huge challenges, and clearly vaccinations are a really good investment. And we want to encourage people to take vaccinations when they're available. And what the goal of policy is to make them available to the people that are most vulnerable. I think there is an efficient path to making the vaccines available to countries that have vaccination programs that can quickly administer vaccines and that have specified which types of vaccines they're prepared to use, and so we can avoid the wastage. So my final thought is that we need to measure our success over the next 3 months by how many people worldwide are vaccinated, especially how many vulnerable people are vaccinated, and we should be trying to shoot for very high numbers. The vaccines are available. We've got to speed up the pace of connecting them with the demand. Thanks.
Thank you so much for this. And Ms. Kristalina Georgieva, Managing Director of the IMF.
Well, thank you very much. The approach we have taken is to ask the right question. And it is, what would it take for recovery to accelerate everywhere and lives that would be lost unnecessarily to be saved? And the answer to this question is in the plan in front of you. First, we have to set up a target that would lead us to protecting lives and accelerating the recovery. 40% this year, 60% by the mid of next year. Rather than asking how much money we can raise, we are asking how much can we and must we spend to get to that target? And what would it be necessary in vaccine production, the reallocation of excess vaccines, overshooting so we can protect against new variants, and spreading protection measures that are in between of getting the vaccines and now, so we can collectively do as good a job as we now see in countries that are successful. The answer to the right question is one that we are very strongly pressing for all of us to come together and provide to the world. And I am confident that we can do it. I am also very, very encouraged by the interest we have seen around the world in that plan. It is a multifaceted plan. It requires all hands on deck. And I pledge to you that each and every pair of hands in the IMF is on this deck.
Thank you so much for this, and thank you all very much for your participation. Now, before I hand back to Dr. Tedros for the final remarks, we will be sending the audio files and Dr. Tedros' remarks right after the press conference, and of course the full transcript will be available as of tomorrow on our WHO website. For any other follow-up questions, please send an email to mediainquiries@who.int, and you also received the press release with the press contacts for the other organizations below. With this, Dr. Tedros, over to you.
Thank you so much, Christian. So I'd like to start by thanking Kristalina, Ngozi, and David. Thank you so much indeed. I think this joint effort, I know, will help us to defeat this pandemic. I think it has been said, but I will repeat, maybe by giving you how the what we're proposing can actually work, because it's working. In countries where vaccination coverage is better, meaning in high-income countries where the access to vaccine is better, and those who have vaccinated a significant proportion of their population, the COVID situation is declining, or the number of cases and deaths is declining significantly. In some countries, it's actually nosediving. So we have the tool. That's why we said we have the public health measures at hand, which have been working in many countries, and now we have the added tool, vaccine, at hand. If we do both, we can end this pandemic quickly and free this world from this dreadful virus. And the only thing which is remaining is, as we have said, it's the will to really use the tools and share the technology we have, share the finance we have. And this is in the interest of all nations, whether it's low, middle, or high-income country. As Kristalina laid out and other colleagues clearly, the world could recover faster and all countries can benefit from that fast recovery with this little investment. So the message is very, very clear. So we ask, I join my colleagues, ask especially the high-income countries to share doses they have and also to help in boosting production. And like what we see in high-income countries, the situation in low and middle-income countries can also improve significantly, so the world could open up everywhere. So with that, thank you so much again to colleagues, and look forward to working with you closely to make this proposal happen. And thank you so much, especially to IMF, to Kristalina, for putting together this proposal. And I believe that this can really open up the world by ending the pandemic. So thank you so much. With that, I also thank the media who joined today, and look forward to seeing you in our upcoming presser. Thank you.